So we're here today to teach you how to manually prone a patient. And first off, I want to show you the supplies that you'll need. You need a board like this to go under the bed, and we'll explain that a little bit more in a minute. If you're on one of our older beds, you'll also need these Velcro straps to strap the board to the bed. You need 2 pillows, EKG pads, the chucks, 3 flat sheets. These aren't draw sheets, they're flat sheets to cover the entire patient. And then you also need a proning pillow. And we're working on getting a foam board. It's a 1-inch board, but right now we just have these to help elevate the head. This piece you would need on our older beds as well because the mattress is so high. Okay, there are 6 people that need to be present in the room to manually prone a patient. You will need the RT at the head of the bed. They are the person making the call for the turns. You'll need the coordinating nurse, which should be the patient's nurse. They will make sure all the lines are in the correct positions and help coordinate that as well. And then you also need 4 additional people to help you turn, 2 on each side. At this point, I want to talk to you about preparing the patient. So make sure that you check for contraindications. Those are listed on this sheet that we'll be handing out. Stop all tube feeds and disconnect from your patient. Perform any cares that are necessary. That would include oral care, pericare, lacquer lube the eyes, and then ointment for the mouth. And then also make sure you tape their eyes shut. Also confirm that a chest x-ray has been done recently and you confirm the position of the ET tube. At this point, you, in addition, want to make sure that you have suction equipment available in the room for suctioning the patient and that you're agreed as to which way you're proning the patient, which direction. And then you would relocate any tubes, containers, chest tubes, etc. to that side of the bed that you'll be proning to. The last 2 things are making sure that your patient is adequately sedated and then preparing any emergency equipment outside the room in case you would need to reintubate the patient. So right now we're showing you the board. It's placed, this is one of our older beds, and so you would want to place it under as far as it can go. And then you're also going to use the Velcro straps to the edge of the bed to hold it in place because you cannot insert it as deep as you can on one of our newer beds. On the newer beds, this is not necessary. So back to this being an older bed, you would want to place a pillow or these extra foam pads underneath to raise the head enough. And then the proning pillow. And then you would also want to place, so if you feel it's necessary, you would want to get a second chuck. So you would actually have 2 chucks and place this over the proning pillow to protect it. Now, if we're on a newer bed, you do not need to use the extra pillow or at the extra height, but you do need to raise the head of the bed 6 degrees to get out of the way of some of the equipment that's on the front of the bed. Okay, here we are. We're about ready to prone. This is Becca, our patient, who's trying not to laugh.
Hi, guys.
So a couple of things. First, you want to make sure that the FiO2 on your vent is set at 100%, and then you also want to max inflate the bed to have it help you. At this point, we're going to roll Becca over onto her left side, and I'm going to tuck this arm in against her, and we are going to transfer the EKG from the front to the back. And you do want to make sure you remove the patches, because you don't want them to be laying on those for 16 hours. Try not to get too personal there. While we're also doing this, we're going to be placing our first flat sheet beneath her. I'll hand Stephanie this flat sheet. And it should go from the neck all the way down so that we can create our burrito here in a minute with Becca in the middle. All right. Roll her back over. Scow your way slightly. Alright. So we'll keep this arm since we are going to rotate towards the vent, close to her side. And we're going to first place a chucks over her, just to protect all of our pillows. And then it's our second flat sheet. This allows us to be able to move the patient and separate them from the pillows. And I initially said for a minimum of 2 pillows. So one over the iliac crest, one over mid-thigh, and you may find that you also need a third down here to keep the toes elevated off the bed. And then our last flat sheet goes over the top of these. Meanwhile, we're also making sure all of our lines, so we're going to remove this pillow from behind her head. And all lines are either at the top or the bottom of the bed. And at this point, we are ready to gather our team. Okay, we're now ready to prone our patient. I have 2 people on either side of the bed to help me. I am the primary nurse, so I'll be directing and making sure all the lines are either below or above the patient, and then our respiratory therapist that is actually going to make the call. So let's have you roll the 3 sheets together, so the one underneath and the 2 on top on either side. I'll just double check these lines. We've got our catheter down there. So we're making a burrito baby. So the first thing is we're going to pull the patient away from the vent because we're actually going to then turn towards the vent. So I'll let respiratory make the call.
Ready? 1, 2, 3.
Okay, the next step is to actually pull the patient to the top of the bed so their axilla are at the top of the mattress.
Ready? 1, 2, 3.
Okay. Third step is to turn up onto their side but not go completely prone.
Ready? 1, 2, 3. So pull towards the side of the mattress and then turn. There you go.
We're going to exchange.
Right there.
Exchange while we're on the side.
Grab it like
So you will grab underneath. So let Justin know when you're ready.
Ready? On 3. 1, 2, 3.
We're going all the way over.
Yep.
Okay.
And we'll have to get her centered and then slide her up again. She
Okay.
kind of slowed down a little bit.
So center again in the bed.
1, 2, 3. And jump up. Just a little. Your axilla
about
Ready?
3 more
1,
inches.
2, 3, go. Okay.
At this point, we'll help hold the head.
Accept call.
Sorry.
Holding your call. Rejoining your call on hold.
So those that are helping could go at this point, and then I'll be putting the head of the bed up and then reverse Trendelenburg. And make sure the bed that's not working today. There it is. It's all perfect. There we go. So reverse Trendelenburg, also with the head up some, and then we're going to bring the knees up so the patient doesn't slide down in the bed. Keep going. Okay. Yes. So a couple of other things once your patient's prone. You're going to just check for the pillow positions. Make sure that they are under the bony prominences. And then we're also going to adjust the arms. So you want them in a swimmer position, one arm up and one arm down. Justin's going to show us that. And you want to switch this every 2 hours. And you can use the pillow that's on the side of the patient up above to help rest their arm.
We actually put one on the side too as well.
Great. And then you will turn the patient every 2 hours as well, shifting the pillows that are beneath them, just like we would if they were supine. Okay, so now our patient is prone. We've placed an extra pillow under her legs, and you should reposition this. You don't want pressure on the knees all the time, and you also don't want pressure on the toes, so make sure you're making those adjustments. And then the EKG leads are set up like this, just opposite on the back. So think of the patient as if they were laying supine. You're placing them in the same position on the back. Our patients typically should be prone for 16 hours and supine for 8. And the physicians have agreed on doing that at 11 a.m. That is when we should be proning, and then supining the patient at 3 a.m. So then at that point we can do chest x-ray, labs, other cares that need to be done for that patient. So just a reminder that some patients may not tolerate being supine for 8 hours, so it is an individual treatment. Also want to remind you that skin checks in these patients are super important. So please make sure that you are checking at a minimum every 4 hours all their bony prominences, just like we would if they're in the rotoprone bed. Even though they're still in the prone position, you would need to do that. And if you need to, use our foam pads, the 11 dressings that we have inside of our carts, so that you can alleviate the pressure on those different bony prominences.